right, y'all. So, Kaiser Permanente Healthcare, California is on strike. Let me tell you how it came up. So, I had actually started follow-up appointment. I said I'll go over, get my flu shot real quick. Boom. And in that whole thing, one of the providers I had seen that I have been seeing for a few years, she said, you know what? I'm taking the plunge. She had been seeing someone on the West Coast and dating that individual for some years now, and decided she was taking the plunge. She is relocating. And in that whole thing, she said, yeah, you know what? That individual works for Kaiser. I was like, okay, never, wasn't all that familiar with them at the time. And she was kind of explaining it to me. She was like, yeah, very, very renowned, a lot of good things to say about them, very reputable, been in the business for a long time. Cool. So I said, okay, so you decided that you're applying with them, or you got an offer from them. What ended up happening? And she said, yep, I got an offer with Kaiser. However, it's a per diem situation. So initially I was kind of like, well, you per diem, you don't have benefits, girl. But anywho, so she's like, okay, it's a per diem situation. Okay. And also with the per diem situation, she said the rate was very, very good. Now, she is a physician assistant, so in there, and she has a number of years experience. So her finding work, I'm like, girl, you're going to find work, you got experience, you got. So in that realm of things, and I don't think she was concerned about it either. However, as it pertains to the per diem nature of the situation, I was like, per diem, sometimes you get work. Per diem, other times you don't necessarily get work. So it's kind of like you decide to make the move. It's kind of risque. And do that, get my flu shot, get everything else situated for my appointment, come home, and I see the headline, Kaiser's on strike. And I'm like, no. So here's a few things you should probably know. Now, one of the things here, they're doing a strike. They're about 3 days or so in, and it looks like it's going to continue at least through this week. It is my understanding that it was a planned event or a planned entity of like, this is what we're going to do for a set period of time. So the healthcare system was aware of that, and they hired a lot of temp per diem individuals to be able to kind of fill that void during the strike. Now, as we've seen with SAG-AFTRA and several of the other entities there on strike, it seemed like there was a continuous strike or a strike going on for a period of time. It wasn't like, hey, this week will cause a disruption, we'll strike. Hey, in November, it seems to be that if their demands are not met, more specifically for Kaiser, we'll cause another strike there in November. And it's like, okay, we get the point, you're causing a disruption, but it's like, what's the deal with the break? It seems like if you're going to be on strike, figure it out, do a deal. Why are we waiting a month to talk about continuing to do negotiations? Something about that just seems a smidge strange to me. I don't know. Maybe there's tactic to it. Maybe it's, of course, being realistic, trying to keep a check coming in. Okay, that makes sense. I can get behind that. I understand that part of it. And still wanting to be able to kind of negotiate and try to get a seat at the table. Okay, I understand that. But with, of course, a healthcare facility as large as Kaiser being able to hire per diem workers or hire, temporary workers, it almost kind of takes away what you're looking to do, because it's almost like you went on vacation. Okay, you were on strike, yeah, but you went on vacation for a week, and we found some other workers to kind of fill the void, or perhaps we found some other workers to fill the void, and we're going to offer them something permanent now. I think we're all set. We don't need you to come back. So that's a different dynamic that could also happen too, depending on how long the strike is expected to go. So, what we know. Again, strike there about 3 days or so. Tomorrow will be a day 4. Per diem, again, in California, their biggest thing is, again, looking for per diem workers, and their biggest issue is staffing shortages. Now, both sides, both the workers and Kaiser agree that there are staffing shortages. And more specifically, the pandemic. A lot of the pandemic had something to do with staffing shortages across the board for the healthcare system. There are a lot of individuals, of course, and me even at the time, I was working in a hospital as well. Again, I was not a provider specifically in that scenario. However, I did provide different services in a hospital throughout COVID. So I understand firsthand. I did see how things unfolded. I saw bookend to bookend, we'll say that. And more specifically, I also saw the impact on how it affected the workers. And a lot of folks were not amenable to some of the kind of snapshot decisions and changes that were made from the top, because those individuals weren't necessarily patient, hands-on, kind of, in the grind of things, kind of seeing what was going on day in, day out. Be that as it may, a lot of those individuals decided to leave the field and on a permanent leave the field, not temporary. And we need doctors, we need nurses, we need ophthalmologists, we need, psychiatrists, psychologists. We need those individuals to be able to thrive as a society. And I'm not sure that's something that the people at the top were really considering. Be that as it may, I think the pandemic was a very, very difficult time, and it currently is still, as numbers are on the rise. It's a very difficult time for individuals, again, patients, families, loved ones, and the whole kit and caboodle. Now, I say that to say, as things continue to progress, those individuals, of course, are often highly educated, and they have options, whether they want to go into the education field, whether they want to do something different altogether. Those options are on the table. Definitely, I know a lot of people who have gone and started their own business and are looking to move differently. Be that as it may, with that being said, there is, I want to say, estimated 2025 to 2030, expected to continue to be a shortage. Now, between that time period, between 2023 and 2030, that's definitely a significant amount of time. Of course, those would be the students that are kind of going through school now or deciding to go to school in the next couple of years to go to medical school for whatever their desired profession may be. But again, if those numbers don't increase, we will continue to have shortages. So definitely let me know your thoughts on that particular area. Do you feel that the strike is warranted, or do you feel that it is a, let's say, way for the employees to be able to negotiate better wages, better, care, or better benefits, or a better deal on behalf of them as workers? So, staffing shortages, and we also, of course, have the money. Everything will circle back to money. I tell you. So 27% increase over the next 4 years. So 27% increase is not bad. It's my understanding that they're offering something around 13-14% now, and they're saying, hey, okay, we can offer 13-14% over the next 4 years of time, but they're saying based on the shortages here and the work of what's expected of us, now it's not gonna cut it. It's not gonna cut it. It's not gonna cut it at all. So 27% over the next 4 years. We'll be interested to see how that works out with the unions and if that is something that they're able to procure. Now again, circle back into November. November, 5 days, they are expected or anticipated to do another walkout. Now I'm not sure if they have specifically honed in on the days. I have not seen that yet. I'm sure that's something they're kind of trying to keep tight knit within the, within the group in and of itself to see what that looks like. And it gives them time between, again, the beginning of October and November to say, okay, this is what we, were on strike about before. We're looking for, staffing shortages, and we're looking for support with wage increases. Where we at? And if they decide to come back and say, okay, this is something that we're looking forward to, or if they counter and do something different, let's say it's not the 20%, or rather the 27%, let's say they come back and do 20%. Maybe that's perhaps something that they come back and say, okay, it's not 27, but you know what? It's not the 13% that they're offering now. Maybe that's something that we can look into. So definitely let me know your thoughts on the Kaiser Permanente healthcare system. Do you feel that it can perhaps change the brand, change the organization? Do you, as a consumer, are you considering going elsewhere because you feel that your healthcare is in limbo or it's kind of unstable? Or do you think that this is just a short-term temporary issue and perhaps later on down the line, things will work itself out? As always, if you found value in today's video, don't forget to like, share, subscribe, comment down below. Let me know your thoughts on today's hot topic, and I'll see you guys on the next one. Bye.